Good afternoon, and thank you all for being here today on Monday, January the 4th. And I want to personally thank you all for what you have done and what you have been doing to help slow the spread of COVID-19 in Mississippi. I know that everybody's holidays looked a little bit different this year, and it's a testament to the dedication of Mississippians that you chose to do that. Of course, the fellowship of a holiday season is going to bring more risk. I believe that the people across Mississippi, while they may not fully appreciate the downside risk, certainly understand that there was risk. We saw a steep drop-off in the total number of reported cases during the week of Christmas. I don't think it was because the virus stopped spreading. I think it was because fewer people were getting tested and fewer were getting reported. So I expect to see some very large numbers with the spread from the holiday gatherings combined with the backlog in testing and reporting that may have occurred during the last 10 days. Right now, the most important task that we have is getting vaccines out to the public. That is our only way out of all of this. Of course, I still believe that everyone should continue to take social distancing seriously. But at this point, as a country, we need to stop trying to run people's daily lives through government orders and start focusing on getting the vaccine out to as many people as possible. Individual Mississippians can reasonably take steps to protect themselves and make informed decisions about risk in their lives. They cannot procure, they cannot distribute, and they cannot administer the vaccine. Only we can. And we need to focus our attention on doing just that. And I will tell you that is exactly what we are doing, and that is exactly what we are focused on. Admittedly, it's going slower than I had hoped. It's gone slower than I think everyone would have hoped. It's gone slower in Mississippi, and it's gone slower across the country than any of us wanted. But it is underway, it is ramping up, and we just need to step on the gas. We spent much of this morning discussing potential avenues of ways in which to do that, and I am convinced that it will improve. In my mind, part of the reason for the holdups is the CDC decision to hold back and focus on who should be getting the vaccine and who should get it first. We need to move fast, and we need to get it out there. We don't need to analyze and prioritize for months and months on end, all the while debating of who is more deserving than someone else. One decision that we discussed and ultimately made this morning, we're going to start allowing vulnerable Mississippians to have access sooner than might have otherwise occurred. Starting next week, those over the age of 75 will have access to the vaccine. Starting a week after that, those over the age of 65 will have access to the vaccine. We're launching more vaccination sites, and Dr. Dobbs and Jim, who is here with us today, will have more details on that. In fact, Jim was out, I believe, in Lauderdale County earlier today, witnessing some of the first facilities being open. We know that we cannot afford delays in protecting those who are at the greatest risk. We must focus on saving lives. And we know that those over the age of 65 are more vulnerable than those of us under 65. Also, just want to walk through a little bit of the data, particularly wherein there was some erroneous data that was spread over the last several days. It was reported that we had been delivered 190,000 doses of the vaccine. Now, I understand that this is nuanced, and understand that the general public may not have fully appreciated all of the differences in wording, but I think it's important for my constituents to understand what these various terms really mean. There was not 190,000 delivered to Mississippi. There was 190,000, actually 189,250, that were allocated to the state of Mississippi thus far. Of those, 163,750 were distributed, at least initially, but of those 163,000, 78,000 of them were distributed to the partnership by the federal government through CVS and Walgreens that were designated for long-term care facilities. And therefore, Mississippi's enrolled providers have been actually shipped 85,750 doses. Of those doses, we've actually administered, and by administered I mean shots in arm, and again, this was at the latter part of last week, 21,653. That is approximately, of those that has gone through the State Department of Health and the enrolled providers, 20,548, or 28% of the total first doses that have been sent to Mississippi had been administered by the weekend. And of the nearly 78,000 through the federal pharmacy partnership, only 1,105, or 2.3% of those first doses had been distributed. I tell you that because I trust the people of Mississippi to understand the facts and the real numbers and know that we are monitoring this very, very closely. Neither one of those numbers, neither the total doses administered in Mississippi through our own enrolled providers or through the federal pharmacy partnership is good enough. We've got to do better. We all share that view, and we're completely focused on ensuring that we do exactly that in the days and weeks and months to come. And so our ask at this point of the public really remains very, very simple. Please keep protecting yourself and keep protecting your loved ones. Over the last several months, there's been a lot of discussion about where we found ourselves in terms of hospitalizations, in terms of number of patients in ICU beds, etc. And I've often been willing to step up and tell the people of Mississippi the truth. And here is the truth. We have more patients with COVID in ICU beds at the end of last week than we have had at any other period throughout this pandemic. We are in month 11 of positive cases in our state. Now, this wasn't true in the middle of November, and it wasn't true in the middle of December. But today it is true. We have more patients in ICU beds with positive COVID tests than at any time during this pandemic. Now, we have worked, and Dr. Dobbs has worked, and we have done various things, including reducing elective surgeries throughout the state. That has slightly reduced the total number of non-COVID patients in ICU beds. It has relieved some of the pressure, some of the stress, but I am here to tell you we are now in a very critical time, in a very critical situation. Everyone needs to understand, and I believe everyone in the state does understand, the risk of getting COVID. The risk of our hospital system and our public health system being overwhelmed. We are at a much greater risk today than we have been at any time during the pandemic with respect to hospitalized patients and ICU beds full. And that's why I ask you, please take precautionary steps to protect yourself and to protect your loved ones. We are going to get the vaccine out to anyone who wants it as quickly as we possibly can. And we're going to continue to work to convince more and more and more Mississippians of the efficacy of the vaccine, of what your willingness to take it will do to help not only yourself, but to help slow the spread. And that's something that we are going to work very hard to do in the coming days and weeks and months. With that, I'm going to turn it over to Dr. Dobbs to give us an update.
Yeah, thank you very much, Governor. So today we're reporting an additional 1,616 new cases and 13 deaths. Sadly, we did see near about 1,000 deaths in the month of December, as we thought might occur. We do strongly anticipate another surge following the holidays. It's kind of been a recurring theme. It's not something that should be too surprising. And this is also occurring when we have full ICU rooms. Our hospitals are really overburdened. So please be very careful. Those things that we do, that we know work, still work. So please wear a mask in public, avoid social gatherings, keep it small and keep it outdoors. If we look at our hospitalizations, we do have the highest number of COVID patients in the ICU at 355 on the latest report from yesterday. We have 1,369 COVID patients in the hospital right now in Mississippi. That's a phenomenal number. And we have seen a gradual decline in the number of non-COVID patients in intensive care. Part of the efforts we took, to decrease it in the efforts of hospitals, a 6% decline in a week. I would like to say thank you to folks working in hospitals, ERs, ICUs across the state. I see it every day. I've been visiting hospitals and seeing what's going on with them. They are stressed. So, be patient if you're waiting in the ICU, in the ER, because it may take many, many hours to get care. But most of all, stay safe and don't need an ER or ICU if you can help it. And please try not to get coronavirus. As we talk about the vaccine effort, the governor did a great job going over the numbers. We are a bit behind where we wanted to be. Part of it, we did have to move a good portion of our Pfizer allocation from week 1 over toward long-term care so we could activate that plan. And so that's about 13,000 doses that we didn't have to work with on the week of December 14th. Most hospitals got the majority of the Moderna vaccine right before Christmas, like the 22nd or 23rd. So a lot of this dosage that we have was actually, we just got recently, so it's not like we've been sitting on it. The hospitals have been doing a great job getting it out. They've been fantastic partners. They're continuing to give a lot out, not only to their own folks, but also other medical providers in their community. There also is a delay in reporting. We know that. And so any numbers that we have are going to be a little bit delayed. I did get an update from our immunization director just over the phone a minute ago, and we have now administered 23,511 doses in our surveillance system. The same thing goes with the long-term care system, where their reports, they have up to 72 hours to put it in our system. So there will be a natural delay. From what I understand, they had 24 nursing homes scheduled last week to get the vaccine and another 44 scheduled today. So we will look forward to them getting more and more folks vaccinated. When we talk about long-term care, people who are residents of long-term care catch coronavirus from employees. The visitation is pretty limited and safe. The employees are the mechanism through which folks can get COVID in nursing homes. So it's so very important for people who work in long-term care settings, work in nursing homes, to go ahead and get vaccinated now. It's safe, it's effective. I've had it. My wife has had it. She's a critical care doctor. And my son, who's a medical student working in surgery, got it too. So obviously I believe in it. And I really think and would admonish everyone who's working in healthcare, especially if you're with old folks, to please get the vaccine. And even if you work in a nursing home and CVS and Walgreens haven't come by yet, we want you to come to the drive-through clinics that we have at the Department of Health available. And I'll let Mr. Craig talk about that in a second. The last thing I want to mention is we're going to try to send about 20,000 doses, more or less, to private clinics this week, who can start adding to that workforce of vaccinating not only our 1A, our healthcare folks, right? But next week we're excited, as the governor mentioned, to start offering it to 1B, especially people over 75. And so those appointments should be available on our website and our UMC partner website in the near future. So look forward to that happening next week. And Governor, with your permission, I'll turn it over to Mr. Craig to give more information on the drive-through locations.
Yes, thank you.
Thank you, Dr. Dobbs. Thank you, Governor. As we announced last week, we have 18 sites, health department locations around the state of Mississippi for vaccination drive-through of healthcare workers. Today, we had 3 of those sites that were activated down in Pascagoula in Jackson County, over in Lauderdale at Meridian, where I was, and up in Greenwood for LaFleur County. All 3 of those sites went off without a hitch this morning. It was really remarkable to see the number of healthcare workers that got there early, looking for vaccine, and to see their faces when they received that vaccine. It was a great day in Mississippi, without a doubt. So tomorrow, we will be in Adams County, in DeSoto County. We'll also be at the Lake Terrace Convention Center in Forest County, in Harrison County, Lee County, Lowndes County, Neshoba County, and at Trustmark Park in Rankin County. We have about 10,072 appointments currently in the system. 628 appointments were made today, and when I left Lauderdale around 11 o'clock, we had 0 no-shows. So everyone had showed up for the appointment that they had made. We will continue to have our teams from the Mississippi National Guard and the Health Department working these locations, and I can't tell you how much we appreciate the help of the Mississippi National Guard in this vaccination effort, as well as those public health nurses and others that are out there helping with this effort. But there are still appointments available. So if you're a healthcare worker and you're looking for an appointment, we have appointments available in the system right now in Batesville, Greenwood, Greenville, Laurel, Macomb, Natchez, Pascagoula, Philadelphia, and Starkville. So know that there are plenty of appointments out there. As Dr. Dobbs said, especially those that are in long-term care facilities. We know that those employees play a critical role in our long-term care residents' health. So it's really important for them to go ahead and get an appointment and come on down to one of these locations, and let's get them some vaccination. That's all I have, sir.
Thank you, Jim, and thank you to you and your team at the Department of Health for helping get us ramped up for more and more vaccinations being in those individuals' arms. Again, I want to just spend a little bit of time, because it's a debate and a discussion that we've had internally, and I think it would interest those individuals. I've said repeatedly today, and I'm going to keep saying it, that we should focus less on who is getting the vaccine and focus on the number of people that are getting it. But I do want to just talk a little bit about the decision to focus these initial doses on healthcare workers, even some of whom are younger and more healthy. We have, and we know, given the number of patients that are in hospitals and the number of patients that are in ICU beds, we know that we already have what is near shortage in total number of healthcare workers. They've been tremendous throughout this entire process. They've showed up under very difficult circumstances, and we thank them for doing so. One of the reasons that we focus this initial dosage on healthcare workers is very clear. Not only have they borne a large percentage of the work throughout this process and throughout this year, but also we simply cannot afford to have 5 or 10 or even 15% of them either with COVID or on quarantine for having come in close contact and being not vaccinated, because we need 100% of those workers that are currently employed and working to be at their shift every single day. The other thing I want to say, and I mean this, and I mean this in all sincerity. Dr. Dobbs mentioned it. If you work in a long-term care facility, your patients, the people that you work with, are oftentimes the single category of most vulnerable individuals out there, because not only do they tend to be older, they also are obviously living in a congregate setting where we have seen time and time again those who live in congregate settings are at higher risk than those of us who live individually. And so if you work in a long-term care facility, I urge you to please take the necessary steps to get the vaccine, because oftentimes what we've seen is we went from well over 200 long-term care facilities with an outbreak down to close to 100 back in September or in October, and now we're back up over 200. I hadn't seen the specific number in the last couple of days, but we're well over 200, and that is largely from workers getting the virus in the community and unknowingly taking it into the facility. So please, if you're in a long-term care facility, if you work there, we obviously have a significant allocated number for you, but we're urging you to go ahead and get an appointment and get that first dose of the vaccination as soon as possible. I am very pleased to hear the update of we have 10,702 appointments. What I want everyone to know is we're going to open this up to those over the age of 75 starting next week. But if we go a week or so and appointments are not 100% full, we're going to move even more quickly. Because again, we want to focus on getting as many people shots as is possible. At this time, we got some fantastic news over, I guess it was New Year's Eve, regarding Hurricane Zeta. I'm going to turn it over to our emergency management director and deputy director. We're obviously glad to have Greg back with us. As many of you know, Greg went through a very challenging December. He himself did test positive for the virus, and I won't go into any details, but this virus treats different patients in different ways, and there's no question that it was a difficult month for Greg, and we're just glad to have him back. We need him back, and we're glad to have him back. So, Director Michelle?
Thank you, Governor. It's great to be back. We did get good news about 2 hours prior to the strike of midnight on New Year's Eve. We got approval from the White House for our 11th federal declaration for 2020 for Hurricane Zeta. We were approved for both public assistance and for individual assistance. For public assistance, those counties were George, Greene, Jackson, Hancock, Harrison, Perry, Stone, and Wayne. And that again is for public assistance. So public assistance will be available to local governments and eligible nonprofit agencies to assist in the cost of emergency work and repair or replacement of disaster damaged facilities. Mississippi was also approved for individual assistance for the following counties: George County, Greene, Jackson, Hancock, Harrison, and Stone County. Individual assistance is available to residents in those counties and include grants, temporary housing and home repairs, low-cost loans to cover uninsured property losses, and other programs to help both individuals and business owners recover from the effects of the disaster. We've already had a lot of activity in the individual assistance portal on FEMA. Over 2,100 residents have registered and applied for individual assistance. Deadlines just to be making a note of for individual assistance. Homeowners will have until March the 1st of 2021 to make application for that. And with regard to public assistance, businesses will have until January the 30th to make application there. As you all well know, clearly we're still in a COVID environment, so most of what we want to do is being done virtually. You can apply online if you're eligible at www.disasterassistance.gov. And then there's a toll-free phone number that individuals can call if you need assistance, and that number is 1-800-621-3362. I say again, 1-800-621-3362. We will be opening physical disaster assistance centers. Those will, again, be operated differently. We'll be maintaining social distancing, requiring folks to wear masks, and do everything we can to prevent the spread, but we will be opening centers. Those centers will be rotated around through counties, and we'll have additional information that we'll be putting out as we get closer to opening those. Our goal is to try to start opening those centers up by Friday of this week. I want to remind individuals, if you come there to make an individual application, you want to bring the following things: your social security card, your contact information, driver's license, damage information to your home, any insurance information that you've got, and financial information such as household income before taxes, any banking and routing information that we might need. We'll be continuing to give you updates throughout the process, but that was good news for Mississippi, and we'll keep you updated as we move along. Governor, that concludes my update for today, sir.
Thank you very much, Director Michelle. We're glad to have Mac with us today as well. Obviously, we anticipate that there are going to be specific questions today regarding various pieces of the vaccination plan, and we want to make sure that we had everyone here that's been engaged and involved in developing the plan as well as in the implementation from the Department of Health, MEMA, and our wonderful men and women of the Mississippi National Guard that have been helping us throughout this process for almost a year now on federal orders, and we certainly appreciate the federal government's cooperation as it relates to Title 32F funding. And so with that, I'm going to open the floor to any questions, and I'll start with Scott.
Governor, I hear you urging long-term care workers to get the vaccine. We've heard a percentage of people have been declining it. Do you know what that number is of those who are eligible for the vaccine versus those who have actually taken it?
Yeah, I don't have a number of those who have declined, because it's not as if everyone that's in any one category has everyone is in any one category. There's a list and they all get a document and they either say yes or no. You know, it's not a question, check yes or no if you want the vaccine. There's a lot of anecdotal evidence out there. There's a lot of anecdotes, and I'm going to let our friends from the health department say if they have any specific data. But there are a lot of people that are still skeptical of the vaccine. And you know, generally speaking, I think skepticism is a good thing. But what you're seeing here is a large number of our medical leaders and medical professionals are stepping up and taking the vaccine. And I think that I hope that as we move through and we get in weeks 3, in weeks 4, in weeks 5, even some of those that maybe initially chose not to take it will change their mind. Now, obviously, if you're a healthcare worker and you were at the front of the line and you chose not to take it, you're not going to be at the front of the line anymore. But you're still going to be eligible, and we still want as many Mississippians as possible to take the vaccine. Do y'all have any specific data?
No, sir, not really. But I will say that talking to some nursing homes, the uptake among the residents has been pretty astounding. I mean, some 80 to 100% of folks when they've had it offered. So, but there is some proportion of long-term care employees that are not taking it. So very important, but we'll work harder to make sure they understand the importance of it. It's critically important for the health of the residents that the employees get vaccinated.
UMMC had frontline workers that had turned it down. That's why they opened their pool of availability to other types of healthcare workers. That's why I was wondering if you had any data regarding that.
I don't have any numbers, not right now, sir. Yeah, but we can get that eventually.
Since rural communities tend not to have the type of refrigeration units that the Pfizer vaccine requires, are the rural communities going to be given more Moderna versus the Pfizer vaccine? I mean, and since the state is not exactly handling it in as much as private companies are, CVS, Walgreens, who will do the determination as to what community gets what, and what's the response that you've seen people towards specifics? I mean, are some people more afraid of Moderna, would rather have a Pfizer than a Moderna? I mean, and we still have the AstraZeneca out there that eventually will come online.
I can tell you where we are, and part of it's kind of a moving target. So pretty much all of the remainder of our Pfizer allocation is going to the long-term care effort. So for the next few weeks, the only thing that we'll be adding to the community effort is going to be the Moderna. And so from a logistics perspective, that makes it a lot easier. And so like the doses we're going to be sending to the clinics are going to be Moderna. But as we start layering in more and more Pfizer, we'll figure out where it fits. We have a lot more capacity through the logistics of the health department, MEMA, and National Guard to kind of do that. So we'll work with that. And like UMC does have pretty good capacity, they may want to have that as well. As far as both vaccines look very safe and very effective, very similar in their profiles, except for the storage piece. So, I don't have any qualms about one or the other. I got Pfizer, my wife got Moderna, and actually I'm not sure what my son got. I'll have to ask him.
Yes, sir.
Yeah, according to the CDC, Mississippi is among the states near the bottom of number of people being vaccinated right now. What is going into that, Dr. Dobbs? Is it people not just too nervous to take the vaccine? Is it some of the delays we've seen? What would all be in that?
I think it's several things. First off, some of the numbers I think were delayed, and so when I looked at our comparison with Alabama and other states, when I did our exact numbers, they were pretty much in line with those guys. So I think that's part of it. part of it is the delay with the Pfizer and having, that's 12,000 doses from the week of the 14th that we moved out of operation. So I think that actually was a big chunk of it if you look at the total number, right? And then most of the Moderna came in 2 or 3 days before Christmas. So it's kind of hard to operationalize. So I think part of it is just that. But I am enthusiastic. I mean, there's a lot of demand out there. People know that it's really kind of a remarkable opportunity to kind of put this pandemic behind us. So I do think that you're going to see a lot more distribution. I mean, we're going to use up what we have pretty quickly. Our allocation is not going to be able to keep up with demand once we start, kind of processing the backlog we have.
And then just to address concerns, how have you been feeling since you got the vaccine?
Oh, great. Yeah, not anything. I mean,
I'm the oldest of the two, and yeah, really
When did you get the
Nothing.
second shot?
Wednesday.
Wednesday.
Yes, sir.
Thank you, Governor. So today we heard you acknowledge that we are at record levels when it comes to COVID hospitalization. Same with the ICUs. But it's been growing for a few weeks. And at UMMC, there's 0 ICU beds. The last I checked, anyway. Same when it comes to pretty much every hospital in the metro. In fact, I think UMMC is actually in the negatives. Do you have any plans when it comes to lifting this burden? Like we've seen some states build mobile hospital sites or just make some sort of expansions. It's been happening for a few weeks now. Do you have any plan to lift this burden when it comes to mobile sites like that?
Yeah, so thank you for the question, and you're right. We've seen growing case numbers basically since Halloween up until the middle part of December. There was a 2-week period there, mostly probably 9 or 10 days before Christmas and a day or 2, 3 after, when we actually saw a downward trend. But again, I think that downward trend was more a function of timing, more a function of people didn't want to get tested 3 days before Christmas because they had Christmas plans and they wanted to spend time with their family a lot of time in a lot of instances. And so, so while we did see a couple 10-day, 2-week period where at a minimum it had flattened out, we are now seeing what we would have expected and what we talked about in early to mid-December, and that is an increase in total number of cases likely this week and probably next week as well. When you talk about the total number of ICU beds available in the Jackson market, that has been an issue all of this year. It was an issue all of last year. It was an issue the year before that. It's obviously more so this year. I think I looked earlier today and the university had minus 14 ICU beds available. We'll have to work through exactly what that calculation. But the fact is that we have had many conversations, including within the last couple of hours, regarding what our options may be. We are looking at a number of different things. There's a potential for a request that is outstanding to the federal government with respect to giving us some access to some federal resources to open additional ICU beds in a community hospital that is available. We've got ability to do that. We just don't have the staffing at this time. So we've got work to do that. We're reaching out to our federal partners and working hard to see if that is a possibility or an option. You may recall that we talked a lot about doing that in August, and the request was made. We got it approved. And as you might imagine, with federal resources comes federal restrictions and constraints. And at that time, there were some in the hospital community that didn't want to deal with those constraints, and so they chose not to take the federal assets. And so we'll see how that plays out over the coming days. But we are asking and have asked. It's a fairly lengthy process to get that approved by the federal government such that they will pay for it. And I will remind everyone, and I know it's hard for those of us in this on a daily basis to realize this, but as challenging as things are in Mississippi today, go look at the average daily case number in Kentucky. Go look at the average daily case number in Kansas. Go look at the average daily case number in every state across the country. Go look at it in California. I looked at LA County the other day. The city of LA has 3 million people, same as Mississippi. The county of LA has 9 million people. The other day they had a 7-day average, I believe, of 14,000 cases a day. in the city of LA, which is about the same size as us. So again, I say all that simply to say resource constraints is a challenge in Mississippi, and it's a challenge in virtually every other state across the nation. So we hopefully are at the front of the line in asking for these federal resources. We have asked. We are going through and I'll let Mac talk about it. It's a multi-step process. I think we're on step 15 right now, if I'm not wrong. And I don't know exactly when we get there, but Mac, if you want to just speak to that a little bit.
Yes, we've been working with the Department of Health on requesting resources, and it's something we have to go through. We have to check with other states around us and do what we call as an EMAC request. Also checking with our National Guard partners. Do they have any more assets that are left? Because we're definitely using those in the state of Mississippi to do all of our vaccinations and as well as our testing and in those facilities. So we have checked with other National Guard agencies. So it's a 15-step process, and we're at about 13 and a half and 14. Jim Craig and myself have been working on that over the weekend, as well as we have to make sure that we've also asked for any federal resources that we need. Once we get through that process, then it's up to HHS to certify those and then to come back and say that we have exhausted all means necessary, local, all the way to the federal, and then they'll authorize us to do what we need to do. And we're ready to pull the trigger on that concept as soon as it's approved.
Is there any time frame you could give us, sir, about when we know what step comes next or when the last step is completed?
I'd like for them to tell me tomorrow. We've been working through it through the weekend, and Jim and myself, we've been working through this probably about the last month and a half. It's a very long process that you have to exhaust every asset that you have in the state, and we hadn't exhausted those assets back in August, so there was no need to do that. So now, as we've gotten closer, we've definitely done that. All those requests have been made. All those resources have been, we've punched the tickets on it. We don't have them. They're not available. Authorize me to go out there and do private contracting, and I'll get them. And that's where we are.
I'll just give you an example of the uncertainty as it relates to getting these things approved. When did Hurricane Zeta hit? What day was that? Late November. Sometime in late November. We received the presidential signature and declaration. I got a text a little after 10 o'clock on New Year's Eve. So there's a lot of uncertainty as exactly when.
We submitted that declaration on November 24th.
November 24th.
We submitted our request to FEMA heading up, so that's over 30 plus days.
We got it on December 31. Now, I'm very, very glad that we got it. I understand that there is a significant number of people in South Mississippi that are signing up for both public assistance and individual assistance. That is a good thing. But if we had gotten to decide, we would have signed it on November the 25th, if not November the 24th. So it takes time. Cordian.
A couple of questions. One, a follow-up to that, and make sure I'm understanding correctly. We're talking about some type of federal personnel that would come in to help, because I know that we've talked about a mobile hospital does this no good, or using an empty space does this no good without personnel. Do I understand that correctly? It would be personnel that would come in?
We are talking about primarily personnel. If you look at our total system, number of available beds is not the challenge. If you look at total number of patients, for instance, we're 600 or 700 fewer patients overall in hospital beds throughout the state than we were at our peak, say, several months ago. The challenge is understanding the differentiation between a regular hospital bed and the resources that it takes to staff an ICU bed. And so we haven't seen a lot of success in the surge plans from some of the individual hospitals in terms of increasing the number of ICU capability that they have. They have plans, but we hadn't seen it actually come to fruition throughout this process. And so, yes, I think we are indeed talking about the potential of getting federal assets primarily in terms of personnel. There may be some equipment and machinery, I'm not sure of specifics, but it's mostly personnel. If we had the personnel, I think we could probably figure out everything else. For instance, we've got 210 patients roughly on ventilators right now. We've got over 650 total ventilators. So we're okay there, but we've got to have someone to actually operate the ventilator, and that's where we find our challenges.
The other question I have, for those folks who maybe are anxious to get signed up for their phase, especially since you guys are ramping up and making the availability wider than somebody that would already be in a hospital setting or in something more structured. What is the advice for them? Do they call their healthcare provider today and say, hey, do I work through you? Do they just anticipate signing up like they would have for drive-through testing? What is the advice for those over 75 and those over 65 that are about to be eligible?
We are going to expand to private clinics. That's one of the next steps that we're going to do. Obviously, our public health clinics in each county, the 20-ish that they have open as of today, is one avenue. But we also know if we're going to get mass distribution, it's got to be a partnership between the public and the private sector, and so we're opening that up to private clinics, and I'll let Dr. Dobbs talk about the specifics.
So there's multiple modalities. We will this week be able to take appointments for certain elements of 1B. We're going to put that on the covidvaccine.umc.edu if you want to go, and that'll be within the next few days. It's not there now. It's still just healthcare workers right now, and you can go ahead and get an appointment. Those will be limited though, right? So we need to use our private clinic partners. There are 174 clinics that have signed up to be vaccine locations in the state of Mississippi, which is fantastic. And we, this weekend, sent out a query to all those clinics who've signed up for vaccine orders and how much they want. So we'll work on a communication strategy, and clinics that are willing for us to share that they have vaccine, we'll publish that also. So there'll be multiple ways, but more to come also. Thank you.
Yeah, I would just add to that. If we've got 174 private clinics that are signed up, they're going to get some allocation in the coming days and weeks. And so I think ultimately, if you fast forward a month or two, probably what we're going to see is that those who have a primary care physician will use their private clinics. Those who do not have a primary care physician, that's ultimately why we will have the assets available through the public health assets that are out there. Now, in the short run, we're trying to get shots in arms. And so obviously that is going to morph into that over time. But certainly if I were 75 years old and I wanted to get the vaccine, I would, number one, make sure that my primary care physician or my doctor was worked at one of these 174 clinics, and then I'd be asking them, when can I get an appointment in the next couple of weeks? I mean, it's not going to be, hey, I'm going to call today at noon and I'm going to come in and get my shot at 12:15, because there is a limited supply, but we've got to be able to get as many. We want to make sure that as many doses as we get this week, we're getting that many shots in arms. It doesn't do us any good if it's sitting on the shelf. Yes, sir.
Thank you. Dr. Dobbs, this question is for you. Can we go back to how many vaccine sites we have across the state, including these private clinics people can go to? And if, the average senior citizen in a long-term care facility may have, problems when it comes to driving themselves, especially if they're over 75. So are there ways to work around getting the patients to these facilities? And is there any cost for the vaccine once it gets to private clinics?
So we currently have operational or will have operational 18 high volume drive-through sites. And so that's going on now. There are 174 clinic partners that have signed up, and those are throughout the state. That also includes community health centers who will be available for rural areas, but also folks who maybe have access to care issues. When we talk about the cost issue, the vaccine itself is free, but there will be an administration fee that insurance has to cover, and I think the Medicare reimbursement's like $28. We can't guarantee if someone was uninsured that a private clinic wouldn't charge them that money cash, but we won't, the health department. And eventually, once we kind of have a little bit more equilibrium, people will be able to go to their county health department and just get an appointment, just like a normal clinic, and get a shot. It's like a flu shot or something like we used to. So it's going to be an evolving process, but please be patient. As much vaccine as we get, we're going to make it available. And then, understanding and agree with the governor that, our vulnerable people, that's where the morbidity is, that's where the mortality is. And so it's certainly an area of welcome focus.
And just, want to make sure that we're looking at the various individuals in the correct way. So if you are, when you say an average senior citizen, you really have to differentiate between those who are in long-term care facilities and those who are not. For those who are in long-term care facilities, we have already seen 78,000 doses that have been allocated to the state, that we asked for, by the way. We asked for those 78,000 to be allocated, and they have been distributed through our federal pharmacy partnership, which was an agreement between HHS and CVS and Walgreens. And so those 78,000, which go not only to those residents, but also to those individuals who work there. So for instance, if you are in, and I'm not going to say specifically the name of this particular facility, but I got a list of every single facility here. There is one in the north part of the state. Their federal pharmacy partnership is with Walgreens. They have been allocated, based upon what our conversations have been with them, 212 doses. Of those 212 doses, 58 residents and 36 healthcare personnel in that facility have already gotten shots in their arms. And this was as of yesterday. This is data as of yesterday. And so I've got this list for every single facility out there. So if you're in a long-term care facility, then you have already been allocated these 78,000, because they were in the very first segment of the population, because they're at the highest risk. So the very first group that got allocations, healthcare professionals, long-term care facility residents, and personnel, they've already been allocated. And so in theory, and this is happening in a lot of places, but not in enough, and certainly not in all, but will happen over the next several weeks. There will be partners that are actually at the facilities to provide those shots to those individuals. So again, let's differentiate a 66-year-old that lives at home versus a 74-year-old that lives in a long-term care facility, because it is slightly different.
Got it. And Dr. Dobbs, if I may, can you explain again where people can go to get these appointments? Did you mention something is on your website? You know, how do people schedule these appointments? And also, are there copies we could see of all 174 of the clinics the governor has held up?
And that was the nursing home piece. So that's a little bit different. The 174 is going to be the different clinics, and we'll see if they don't mind publishing it. I mean, you can imagine that some may not want to. But your other question was, where do you go? So
yeah, to schedule like appointments and everything, like I think you had mentioned earlier.
Yeah, go to covidvaccine.umc.edu. They're our partner and have been a valuable partner in all this effort. To schedule it. And also, if you are not internet savvy, there's a phone number that you can do. So call or register. Right now, it's really going to be through hospitals and through the drive-through clinics, but just know we're working to expand as many opportunities, whether it's through the clinic or then local pharmacies too, to have access to vaccine.
Yeah, and again, clarification. The 174 number, that's the number of private clinics that they have gone and signed up, and they have asked for vaccines that they can distribute to their patients or their clientele. The report that I was looking at, that was long-term care facilities and what has already been allocated to those long-term care facilities based upon what we believe to be the total number of residents plus the total number of employees. But those are two separate and completely different groups that are being vaccinated simultaneously by different groups of individuals. On the long-term care side, that's through a partnership with Walgreens and CVS. 174. These are your, I think by and large, your local mom and pop doctor's offices in places like Florence, where I grew up. So, and various clinics such as that.
And just to make sure I understand, at these 174 private clinics or pharmacies, that you still need to call ahead or log online to schedule an appointment.
No, not with those. That's just for the drive-throughs.
Okay.
Yeah. The covidvaccine.umc.edu is just for the drive-through clinics. Individual providers, clinics and physicians will do their normal operation.
But I'm sure you would have to call and get an appointment with your local doc to get the vaccine. I don't think you can just show up. Although, and by the way, keep in mind, these 174 clinics are getting these doses shipped to them as we speak. So they're not necessarily there yet. So that's going to be over the next 3 or 4 days. It's one of the reasons that we have chosen to expand more quickly to sending doses to those 174 clinics. Yes, sir.
Yeah, last Sunday, December 27th, the president signed a coronavirus relief package. Do you know what allocations Mississippi might be getting from that in terms of funding to help through this pandemic?
Yeah, so the president signed the report. The single biggest, the two single biggest areas in which the vast majority of the resources will be funded are the enhanced unemployment assistance, which is at $300 per week. That will be funded through our unemployment trust fund. That's one area. A distinct area is through the $600 checks, or in some instances, wire transfers that will go into individuals' checking account that earn less than, I believe it's $75,000 for an individual and $150,000 if you file jointly. And so that's where, of the $900 billion total package, the two biggest areas in which Mississippians will see significant benefit is from the $600 checks that go into your checking account, either wire transfer or checks, as well as the enhanced unemployment compensation.
Governor, how do you think this vaccine program could have moved faster? You alluded to it at the start. If we worried less about who was getting it as opposed to when, could you expand on that, please?
Well, I just think that there was certainly a lot of conversation, and all well-intentioned, primarily by the federal government, in trying to pick and choose, knowing that we had a limited supply in the short run, trying to pick and choose who was best to receive the vaccine. I think it was all well-intentioned, and I think that's fine. But as we look to what we're talking about now, we know where the most vulnerable populations are. We know what our primary goals are. We've got to try to, we're trying to minimize the number of people who get the virus, but we're really trying to minimize and mitigate the number of people who ultimately will need hospitalization and ultimately try to reduce morbidity and trying very hard to focus on the older population for that. Look, the reality is that this is a very, very, very big program. It's something that is just taking a little bit of time to ramp up, and it's not ramping up as quickly as any of us would like. But we're making necessary adjustments on the fly, and we think that's the right thing to do to protect as many Mississippians as possible. Yes, let's go to the board.
Alex Rozier from Mississippi Today has a question.
Good.
Hey, thank you. Geographically, are certain parts of the states going to be prioritized at any point for vaccine distribution or other parts?
I don't know of any plan to prioritize based upon geography. We find ourselves at a point now where the vaccine is and the transmission of the virus in various communities is high throughout the state, and so unless y'all know differently,
I mean, we plan to make it available to everybody, regardless of geography, rurality, race, ethnicity, access to care, insurance status, that sort of thing.
Nick Juden with Jackson Free Press has a question.
Hi, thank you, Governor. First off, Colonel Michelle, we're all glad to see you back and in good health. Governor Reeves and Dr. Dobbs, to help us understand the value of vaccinating populations by age, can you discuss the proportion of hospitalized and dying Mississippians that are in these newly elevated categories, and what effect widespread vaccination of these groups could have on our hospitalizations and deaths? And I'll have a quick follow-up for Dr. Dobbs after that.
Yeah, and we've done some analysis of this, and if you look at the average age of hospitalization for somebody with COVID, it's about a decade older than non-COVID patients. So it clearly hits older folks. I don't have a breakdown of by age right now. That data kind of comes in sort of, but actually there's going to be a publication in the State Medical Journal about this probably this month. It's some good information. Like we've talked about before, 12% of folks who get diagnosed COVID over the age of 65 die, which is astounding, about 1 in 8, which is crazy. And a large number of those are obviously going to be in the hospital. So that's a big part of the hospitalized population without a doubt. And so that does take the pressure off. So if you look at the older folks, at the vulnerable folks, and if you look at the healthcare workers working in the ICU, that's kind of like approaching it from both sides. And it does sort of relieve the pressure, and we're hopeful that combination will be fruitful.
So I will just throw a few numbers in of the total fatalities that are marked as a result of COVID. There's obviously about 4,800 total fatalities to date over the last nearly 1 year. Of those nearly 4,800, 3,732 of them are over the age of 65, and an additional 856 are over the age of 50. So somewhere in the neighborhood of 45, 50 are over the age of 50, of which 3732 are over 65. Conversely, of the total number of cases under the age of 50, some 130,000 of those are under the age of 50, and we've had approximately 300 fatalities of those under the age of 50. So it certainly affects those under the age of 50. It can have a very, very bad outcome for those under the age of 65, but the vast majority of the fatalities, unfortunately, are in those categories of individuals over the age of 65.
I think Nick had a follow-up.
Okay.
Yes, thank you for that. Dr. Dobbs, we've received confirmation that the new UK strain has been detected in a number of states, Colorado and now New York, I believe. How are we scanning for this variant, and how will we react if it arrives and becomes more prevalent? Obviously, it's more infectious, if not more deadly.
Yeah, so there's a lot to unpack in that one, because, it changes the playing field a little bit, right? I mean, it also increases the number of people who need to get vaccinated for us to get to a herd immunity threshold. So it makes it a lot more challenging. The more we do to contain the spread of the virus, the less likely we are to encounter these unwelcome mutations. So the things that we do that prevent transmission, which are simple and they work, we'll need to keep that up. And will we have those cases in Mississippi? Absolutely, I have no doubt. This is a virus that's very insidious, and it kind of pops up and is there before you know it. We are submitting samples to CDC. There's a surveillance effort going on across the country to do a certain number of samples so we can see if we are seeing that variant. Same sort of thing we do for influenza every year. So we will be watching it, but if it gets here, I don't think we should be surprised, but the same steps that we know we need to do are still in play. Fortunately, it does look like the vaccine is still effective, and the quicker we can kind of get the lid on this thing, the less likely Pandora's box is going to reopen.
Yes, ma'am.
Dr. Dobbs, you had tweeted recently about activating the crisis standards of care. I know that last week UMC told us they were still at contingency standards of care. Can you tell us how, if those federal resources were able to come in, if that would impact that, if we would be able to pull back some, and kind of where we stand in relation to that?
Well, crisis standards of care is a mechanism where hospitals can try to allocate resources most efficiently to the most benefit, right? And so it can be a whole bunch of things. It can be something as simple as working larger ratios, less nurses to more patients, and we're seeing that already. So in a way, we're already in that sort of mode. It can be things that we're seeing already, like putting multiple patients in a single ICU bed. I mean, room, not bed, room. We're there. Now, one of the things that people are worried about are those more severe ones, like, does someone get a ventilator and someone doesn't? We're not quite at that stage now, but healthcare is an exhaustible resource. We've been talking about that. And it doesn't come as a steady stage where you can plan it. It comes in massive surges. And so each hospital has its own plan. Each hospital is already empowered to activate that plan if they need to, for, based on what's out there. And are we going to see some hard decisions? I think we are. And especially if we think about going into this post-holiday surge, which is impossible, not that it's not going to be there. I mean, this isn't advanced calculus. This is 1 + 1 = 2 kind of math. And like we've been saying, it's not like there's any sort of magic crystal ball. It's like you see the numbers, you see, for every number of cases, 7% of them are going to end up in the hospital, right? And a subset of those are going to be in the ICU, and a subset of those are going to die. So it's going to be tough, and it's going to be hard. And we're already seeing it where patients can't move to the hospital they want to. We're also seeing it where hospitals are having to work under a mandatory rotation to take new patients. Otherwise, they wouldn't be receiving the care that they need. So it's a difficult situation. The best thing that we can do is prevent transmission.
Keisha Rowe, Clearing Ledger, has a question.
Good afternoon, gentlemen. This question is mostly directed at Dr. Dobbs and Mr. Craig. Earlier today, the Department of Health released a vaccination phase estimated timeline, and I realized that having people age 75 and older was part of the phase 1B.1, and ages 65 was actually part of phase 1C.1. My question is this having those essentially moved up, is that changing the timeline, and when will or does that change when the vaccine will be available to the general public?
It doesn't really change what's going to be available to the general public. The 1B.1, the 75 and older folks, it's mid January next week, so that's kind of consistent with our plan anyway. We are looking to accelerate the timeline on the 65s. As the governor and I discussed earlier today, and certainly that makes a lot of sense. So we understand and appreciate how important it is to get vulnerable folks protected. So we're trying to stick within the parameters of the CDC guidance as much as possible, while simultaneously recognizing the vulnerable folks who definitely need the vaccine as much as possible.
The only thing I would add is that I don't know exactly how you define general public, quote unquote. I'm sure everyone in here may have a slightly different definition of that. I would just point out that if you're over the age of 75 and you're eligible to get the vaccine, you are a part of the general public. And so I think we're phasing our way into everybody in the general public having the ability to get it. But we're starting obviously with those older populations because of their fatality rates.
Thank you, Governor. I'd like to go back to my first question to make sure I clarified something when it came to the hospital expansion possibilities because of the burden with 0 ICU beds and much more hospitalizations. I'm sorry, I don't know your name, but with Mima on the end.
This is Mac. Mac.
Okay, great to be speaking with you, Mac. I had heard in your last statement you had said you could if you got authorization, you could get a private contractor when it came to making these expansions. Governor, do you have authority to give him authorization to hire a private contractor if we don't have time to wait for these federal assets in this matter?
Yeah, this is utilization of the Stafford Act. We had to, for instance, they can go into details, but they entered into contracts with private contractors to get masks. They entered into contract with private contractors to get gowns. They entered into contract with private contractors to get other PPE. And so the only difference here is they would be entering into a contract with a private contractor to get personnel. It's not cheap, by the way. It's quite expensive, in fact. And I wish that we were not in the position in which we were having this conversation. But for a myriad of reasons, we are. And so with that, I'll turn it over to Mac if you want to. By the way, this is what MEMA does. In natural disasters, they find resources, they allocate resources, and we find ways in which to pay for it.
So either way, just to make sure you understand my question, I'm basically asking, would you say, if it is expensive, would you say it is still the right time to go for private contractors to get personnel to lift the burden off of hospitals based on the numbers we're seeing?
If you need a resource during emergency management, it's what MEMA does, then we get that resource for you. If your house is on fire, you need a fire truck. I mean, it doesn't matter how much a fire truck costs, does it? You need to put out the fire, and that's what we've done our due diligence with the Department of Health ourselves, and with the Guard, and with other entities that are out there and already have those sources normally that are available. But now every state wants them. Every state is going through the same process we're going to. Their bed space is not there, and when they get bed space, their workforce is not there because that workforce is going to work in their own hospital. So we're available to do this. It's part of our normal disaster, if you can call a disaster anything normal. I don't think you can, but in this case, it's what we do. We are resource intensive, and that we go after these every day with the federal government, with FEMA. We've been talking to our partners at FEMA as well as through the National Guard and as well as the HHS. So this is not unfamiliar territory. We've already done emergency contracts this year to get the right things in the right place at the right time to make a difference. And this personnel contract is nothing different than what we do every day.
So is now the time, would you say it's appropriate to say now is the time to use private contractors to get personnel if we don't have time to wait for the federal assets?
If there's federal assets available, and they will send me the doctors I need, the respiratory therapists that we need, the nurses that we need, and Dr. Dobbs and Jim Craig would tell you the 15 other people that we need to actually observe and watch those patients in those rooms and to do it properly. They're the ones that are giving me the list. I'm going out and shopping for them, and we can get them. But I don't believe the federal government can fund 50 states and territories with those that we need right now. So we're going to have to fall back on private entities and those corporations that can do it.
Yeah, I would just simply say at the end of the day, I guess the responsibility lies on me to make the ultimate decision to ask for what resources we need. But this is conversations that my team at MEMA and the National Guard and Dr. Dobbs and his team at Department of Health, we have these conversations every day. What resources are needed to help us get through it. Like I say, in early March, it was the resources we need are more masks. The resources we need are more gowns. The resources we need are this PPE or that PPE. We now have a warehouse, a nice warehouse full of PPE that we're continuing to ship out. If and when they tell us that this is a viable plan that needs to be resourced, I'm going to sign off on us finding the way to get the resources, assuming the federal government will work with us.
Emily Pettis with AP has a question.
Hi, Governor. The legislative session, as you know, begins tomorrow with people coming in from all parts of the state. There's been discussion by Lieutenant Governor Delbert Hosemann of the legislature working for a short time, then leaving for a number of weeks and returning later so that the legislature will not become a super spreader event. I wanted to ask your thoughts about that, and also, while I have the floor here, if I could ask Dr. Dobbs about whether legislators or staffers at the Capitol are going to be moved up in any way on the vaccination list, given that there are so many people working in close proximity. Thank you.
Thank you, Emily. I'll just say that the legislative calendar is the prerogative of the legislature, and that is a decision that they will make themselves. And from my perspective, it doesn't, I don't really have a strong opinion one way or the other. That's something that they can and will decide. I will point out that most of you in the press have worked every day since the beginning of this pandemic. Most private sector individuals in Mississippi have gotten up and gone to work every single day, and most of these legislators work in the private sector and when they're not in the legislature, and they've been out and about doing that as well. So again, but the calendar is their prerogative, and they'll make whatever decision they make, and we'll work with them to hopefully get there. I know that a large number of them have had the virus and certainly have hopefully are therefore immune, at least for a period of time. And then hopefully when we are able to open up to those over the age of 65, certainly many of those in the legislature that fit in that category will have the opportunity to get vaccinated at that point. And I'm hopeful that is sooner rather than later. So.
And we've had several conversations with the leadership on the House and Senate side. They feel pretty strongly that they don't want to jump the line, they want to go within their phase, especially on the age. And I know that they feel strongly that they want to protect their older members, which I certainly appreciate that. They are doing essential work, and at some point, I haven't gotten them pinned down on where they think they are in a 1B or a 1C sort of area. But as soon as we can, we'd like to protect them all. But certainly the older folks, the 75 and older and the 65 and older, definitely need to be protected as soon as possible.
Thank you, Governor. Going back to the latest stimulus package that was sent down from D.C., do you agree with President Trump that Mississippians making less than $75,000 a year deserved a $2,000 stimulus check? And what do you have to say for the Senate controlled by Republicans denying it, let alone Mississippi's representatives, with the exception of Benny Thompson, voting against $2,000 for the people of Mississippi?
So that's obviously a decision that the Congress made. There was an agreement in place in which the federal government spent approximately $1 trillion on this particular package, and that is coming on the heels of having spent about $4 trillion in CARES Act monies and other things. And so I certainly want Mississippians to get as much money as is possible for them, particularly those individuals that have been most harmed financially from this particular pandemic. I have to point out at this time that, as I've said repeatedly, in those states where they were shut down for weeks and weeks and months on end, there is significantly more individuals in those states that have earned significantly less money. For those individuals in Mississippi, a large percentage of those that are employed and continue to be employed have not had loss of income during 2020. So I'd love to see I'd love to see the Congress increase benefits for those who have been financially harmed by this. When I think of that, I think about restaurant owners and people who work in restaurants. Obviously, even in our state where we have been very, very careful about shutting down small businesses, restaurants have really suffered here. Mainly mom and pop restaurants all across this state have really suffered, not only from, and mostly not from government action, but just from people not going out to eat. And there's been a change in behavior. And so there are a lot of areas in which we would love to see more of our fellow Mississippians that need the help get the help.
So would you have supported them getting a $2,000 stimulus check?
Well, obviously, I think that that's for the Congress to decide. It's for the members of the House and members of the Senate, and I think this is always true, but it's certainly been true in 2020 and the first 4 days of 2021. I have enough to say grace over, then I don't have to do their job for them.
Hunter Dawkins with Gazebo has a question.
Thank you, Bailey. Thank you, Governor. Quick question I have for Director Michelle. The question is about the Thursday of last week. President Trump signed a letter, or signed the letter that you sent out, Governor Reeves, about the emergency declaration for the areas that were harmed by Hurricane Zeta. My question would be for you, since there's quite a number of, a lot of money, at least from the harbors that were partially destroyed on the Gulf Coast. When is the distribution, do you think, of that money is going to start happening, at least to make repairs on those areas?
Right. Yep. Thanks, Hunter. Appreciate the question. So the municipalities will have 30 days to get their project work statement submitted in for the public assistance, which is what a lot of those harbors, most of those harbors will fall into. And once those project work statements are submitted, then they will be sent to FEMA for consideration. So we still have a little ways to go. We got to get through that first 30 days. Now, some of those municipalities will get those in early, and the sooner they get those in, the better off. We will work with them to get those projects completed. And then once they're sent up and approved, then we can start getting reimbursements back and get some of the work. And we hope that will happen quickly, but like everything else, depending on how bad the backlog is, there were a number of states that were affected by Zeta, but we'll stay on top of that and help those municipalities get that money rolling as quick as we can.
I would simply add, Hunter, The director and I were at the Long Beach Harbor the day after Hurricane Zeta, and the damage was extensive. It was enormous, and it's going to take a lot of effort. It's going to take a lot of resources to get it built back, but we are committed to doing exactly that.
Thank you, Governor. Most of my questions have been answered in some shape, form, or fashion, but real quickly, Dr. Dobbs, in section 1B, congregate setting workers are referenced. Who are those people?
Well, it could be someone who's working at a halfway house, or someone who's working in corrections, right? So if you're an employee for corrections, or it could be if you work for a homeless shelter. So basically anywhere where people live together in a large group that's not their nuclear family, the folks who work there would be eligible to get vaccinated.
Well, I think we've been here an hour and a half, almost, and so it's been a good opportunity for you to ask questions and for us to try to convey answers that the people of Mississippi can understand. We're going into a very critical phase, both in terms of cases, hospitalizations, and also vaccine distribution. And so thank you, all of you, for being here, for helping us get the information out to the public, and we will be available for questions, I'm sure, in the coming days. So thank you all. God bless, and stay safe out there.